Guys, if you're suffering from shoulder pain and for months you seem to just can't get rid of it no matter what you've been doing, you're in treatment, it's just not going away. Well, believe it or not, it could be coming from your neck. And this is a real live demonstration of a live patient treatment that we're going to perform that dictates that very thing. Where Dave was in treatment for 8 months with shoulder pain, he just wasn't getting better, he was getting frustrated. He came to me, we were able to figure out it's coming from his neck, started treating that, and sure enough, he's just seeing improvements after improvements. This is now fourth week together. So we're just going to demonstrate a few things that we're doing with him. And anything you want to add?
No, just that, everyone's been treating my shoulder. I see the doc over here and goes right for the neck and made
Immediately. Well, it just made sense. They're treating the shoulder for months, not getting anywhere. It just makes sense to look at a body part above, which is routine in my practice.
Yeah.
And it worked out really well for him right away. So
absolutely
great.
Yeah, I'm very happy with the progress, and it's feeling a lot better.
Beautiful. So let's we'll lay you down here. So we were doing joint mobilizations to the C5 facet joint, which 5 and 6 levels control the shoulder. And when I got on there on the first day, I felt a rotation. So that rotation was signaling pain out to the shoulder. So we started working that gently, and over time, Dave was able to tell me that is the area. When we push on that, it signals pain to the shoulder, which was what he was trying to get resolved. And that is what we call a comparable sign. So that tells me that that's the pain generator. Just work that a little bit. See, what they were doing was trying to release his upper trap, which in turn they've released it so well that they inhibited it and made it weak. So now he has compensations at the shoulder level just from that being done for too long. That really feels good now. How's that feeling to you?
Yeah, no, that's like you're right on it.
Yeah. Now, compare from over the weekend, is that more tender now than last week when we were doing it here?
I'd say slightly, yeah.
A little bit more tender, yeah. So that's leading to that active release technique that we did. Okay. Sit up. So now what we just did last week, which was new to Dave, and he had a bit of a setback, was an active release technique. So we believe that to finish him up, we have to get rid of what I'm thinking is a muscle adhesion along the C5 and C6 vertebrae. So what we're going to perform now is an active release technique to get rid of that. So I'm just going to get on this muscle, and he's going to tell me if I'm on the right area.
Yeah.
Right there, right?
Yeah.
So we're going to hold that down and go ahead and move the head. How does that feel?
Yeah.
Compared to, yeah, that's it, right?
Yeah, that's it.
Rest. So we did about 10 or 12 repetitions last time. We're only going to do half that, so that was 4.
Yeah.
We're going to do maybe, 3 or so more. Everything straight.
Yeah, that's right.
2. Do one more. Okay. All right. So we're going to cut it short just so he doesn't get that same flare up that he had over the weekend, and he want to strangle his kids, because he's got neck pain.
Yeah, we don't want to do that.
We want the kids to survive.
Yeah, we don't want cranky daddies going.
All right, lay on your back.
Yep.
So now what I see a lot in people treating the spine or any joint for that matter is if you're breaking down the muscle or working the muscle, manipulating the joint or mobilizing the joint, they don't act activate the muscles around it right after. And then they let the patient go home with inhibited muscles around that. So what we've been doing with Dave is just some simple side bending against some resistance. So, go ahead. Ready? Yep, he's nice and strong now. 3, 4. You all right? Yep. Oh yeah. Now he's so much stronger going left, but the right has really been picking up in strength. Good. Yep. Oh yeah. Yeah. 6, 7, 9. Good. Okay. Sit up. You definitely feel that loss of strength. So now when we did that release, that right side bend was much stronger last week before the release. And so now it got a little weak.
Yeah.
So I definitely think we're onto something in treating. I believe it's an adhesion in there that's just kind of hanging around and keeping this last little bit from getting out of there and abolishing these symptoms. But I'm curious to see how you respond to this second go around of the active release, but you definitely feel the weakness one side to the other, right?
Yeah, 100%.
Okay, beautiful. Anything else you want to add? Tell the folks at home.
No, just that, I will tell you one thing, that it's the first one that's actually come by that's actually listened to me when we had our intro, when you had your fact finding, and you were able to target the area. I've been treated for quite a while, and everyone's been, like he said, been targeting my shoulder. First time we've actually gone to the neck, and it's made drastic difference. So a lot of the tension that I've been feeling, not necessarily pain, is dissipating, which is the main point.
Yeah, that was the main goal.
Yeah.
Get rid of that.
And I do feel myself getting stronger. So
beautiful. So there you have it, guys. Shoulder pain, sometimes it's leading from the neck. If you need to message me, you can find me on the web or call the number at the bottom of the screen. I'd love to help you out.